with. And S with a line above it is called, is what? Without. So this is with, and this is without. What this means is with glasses or contact lenses, or without glasses or contact lenses. Are you guys with me? So you want to make sure this is documented when you are performing the visual activity. Now, there's so many ways. The manual one, traditional one, is the visual activity using the E or the Snellen chart or the big E chart. Are you guys with me? And now in the clinic, we have some high tech. As the high technology comes in, we have now this electronic kind of type of visual activity device that you can check. And normally, what happens is they say 20/20 vision. Are you familiar with that? What's your vision? 20/20? That means you can see what? An object at a 20 feet distance. So right now, what we need is your chart. This is the Snellen chart. There are some patients that are not able to identify their alphabet. Then you have this big E tumbling chart. It's like the big capital E, and it's just tumbling all over the place. And it just gives you the hand signal, which is pointing upward, sideward, downward. Or they have some little objects like this for the pediatrics. This is the way you test the kids, like, hey, can you tell me what's mine? What is this? What is this? A heart! So that's how you can move one. Animated when you're animating testing for the visual activity. And, I'm sorry? If the person speaks another language, tell them to go back to where they come from. You always have an interpreter.
It's like the alphabet.
Yeah, it's like the alphabet.
Start saying it, and you don't.
Yeah, so then you can have the interpreter. Absolutely, it's a requirement by the federal government that you have to provide an interpreter for any healthcare provider. That they don't provide interpreter, you're going to be penalized for that. So just be mindful. That's a very good question, and my first response is the best answer. Go back to where you came from. No, I'm not kidding. Or bring your own interpreter when you come to America. How's that? Oh, I like that, right? Bring your own interpreter if you come to this country. Okay. Now, we are going to start working on the visual activity. And Eric is my patient at a 20 to 20 feet distance away from the chart. Now, this is what we call an occluder. An occluder is what? It's like there's 12 pinholes, and the pinholes are supposed to be sharpening your vision. So you're going to check the patient's eye without the pinhole first. The pinhole first. You're going to start. It's always good practice to start with the right eye. So if you're checking, especially the elderly who want to pass the driver's license, their son is they're sneaky, and instead of coming in, they were like, they're reading the chart with both eyes instead of the right eye, or with the one eye. So Eric, my name is Leonard. I'm your medical assistant today. You're introducing Dr. Bernard, yes? And I'm going to check your vision. The chart. Are you guys? No, I just repeat. Are you ready?
Yes.
Alrighty. Eric, I'm going to have you hold this occluder. I will have you. Okay. Now, Eric, looks like is that prescription glasses? Or is okay. So we'll check your eyes first with no prescription. Would you please remove your prescription glasses? Very good. Sometimes some patients they cheat and they say, please remove your prescription glasses. When you turn it back, they put it on because now they want to pass the test. Because they want to have the driver's license, and he is 95 years old. Okay. Same thing, if the patient wears contact lenses, you want to make sure that have them remove the contact lenses first. Check first the visual activity with or without the glasses or contact lenses. You always have to ask, are you a contact lenses wearer or do you wear glasses? Well, obviously I wear glasses.
Okay, so if they're wearing their glasses or their contact lenses, they are to remove them for the first one or wait?
Yes.
Okay.
Alrighty. So Eric, I'm going to ask you to wait. Okay, don't wait too much down. Okay. Whew, hot in here.
Can't they just turn it off? Can't they just turn the heater off?
No. Is the heater off? On?
No, I just turned it
Yeah,
on.
it's been
All right. You want to ask if the heater can be turned off? It's not on. It should be on.
Yeah. It was.
Maybe you can ask
Straight up
Dawn.
So you think you're
Can we break that window right there? Okay. All right. Eric,
this is our last day here.
let's start. Cover your left eye. We're going to start with your right eye. I'm going to have you read the line, the second line. Can you please tell me what the letters on the second line? From left to right?
L D O Z O T R C N C.
Okay, so now I'm looking at the letters. It's L D O C O T O P. So he missed two letters. So that is 20/20 line. Because he missed 2 letters, I'll give him another chance. That's without the occluder, without the pinholes, right? So, all right, Eric, how about the line above? Can you tell me?
CFRTEOEL.
Okay, you missed 2 again. So how about the next line above?
CFCZ.
I can't even see it.
Okay, you're totally blind.
With only glasses, I can't see it.
I'm just kidding. So you always have to start, depending if you don't know the history of the patient, you might want to start at the 20/20 line, which is LEZZOTEP. Now I'm just watching because it keeps missing 2 letters. I keep going. I think it's a perfect line. Yeah. Okay. Let's see.
CLFED.
What line did you read?
The one below the green line.
Okay. So this one. CLP what?
I thought that was that.
You missed one. You know, if you are 20/50, that's legally blind. In
If I
terms of
squint,
medical
I
care.
can see a lot better.
What?
That's
Oh,
cheating.
okay.
Okay, maybe a PTCO.
Okay, you're at 20/60. Perfect. Now put the pinholes down for me, please.
How do you balance
This is the number on the side.
So,
Oh, look at that.
Okay. All right. So tell me which line can you read below the red line?
Foxtrot, Papa Charlie, Delta Tango.
What the heck
Lima,
was that?
Echo.
Okay. Wow, it's good. So you have what line?
That was the bottom line.
The bottom line, 20/15, with a pinhole. So I'm just going to put here 20. Okay, how about the line above that?
LVCZOTEP.
Okay. So without the glasses, or without the glasses, what was his reading earlier? 20/60,
60.
right? Now with the glasses, I'm gonna put here what? 20/15 or 20/20. With the pinholes. Now Eric, switch over to the other hand, please, other eye. Left eye without the pinholes. Tell me what line you can, just read whatever line you can read without straining.
GLFED.
Okay, about the line above that?
PTCO.
Thank you. Okay, will you please put the pinholes down? Tell me which line you can read.
Bottom. FPCDTZLE.
Very good. Okay. So, it looks like his left eye without the glasses, on its or without the pinholes, is 20 over what? 60, yes? And with the pinholes down, is 20 over 15. Same thing with the other side. All right.
is OD left? or
OD is right.
Okay, because you did it right. You did it right first.
Oh.
Okay, I see. It looks like it's left, but it's
Right. Yeah. Okay. Then put your glasses on, and let's measure your visual acuity with the glasses on.
Do you want me to do both eyes?
Start with the right eye. Start with the left eye first. Let's start with your right eye.
Okay.
What's your? Go ahead and read.
Bottom one. FPCDZ. Nope, sorry. CDTZLE.
Okay, that's 15. Good. And then switch to the other eye.
FPCDTZLE.
Reverse it. From no. Read from the left to the right.
ELZTDCEF.
Okay, very good. So obviously his glasses is really good. Yes. So with glasses, what is this reading? 20/15? Both eyes, yes? Are you guys with me?
Yeah.
Okay.
I'm not.
You're not following me? Okay.
That measure of the 60.
Okay, 20/60 is without the glasses with no pinholes
Is that
down.
a J and the G or?
Glasses.
Okay.
Okay. All right. So in your documentation, when you find out your documentation, I'm just showing you what are my readings, but in your final documentation, I will document that without glasses, his reading was what? 20/60 without the pinholes, yes? When I put the pinholes down, his reading was 20/20, yes? Are you following me? Earlier, without the glasses, I talked about it, without the glasses, and the pinholes are up, it was 20/60 on the left eye. When I asked him to bring the pinholes down, it helped him and his vision went up to 20/15. Yes?
Is there a special way to designate when it's open over?
there a special way to designate with and without the pinhole?
Yes, in terms of documentation?
Yeah.
Okay, in your documentation, you just have to, you cannot document everything what you did, just put in your mind. So the final will be with or without the pinhole. So when you say the pinholes, you can always put it on the side or your the cheat note. As a medical assistant, you will do that. What the doctor would like to say is your final reading. So without the pinholes, and say if you put without pinholes, then you put your reading 20 over whatever 60, like this one. Because I guess what confused you is I put without glasses here.
No, but the 60, how they measure 60, how much is each line?
The numbers on the side. There's numbers here, 2015, 2020, 2025, 2030. So this is your measurement. What it means on the side, this is what the doctor is going to be basing what your vision is. At 20 eyes with no pinhole, they have both eyes with no occluder. Go ahead and read the whole thing. With 2020 or 2015, yes?
F, B, C, D, T, Z, L, E.
Now, 2015. Now, the purpose again, like what I said, why the doctor or why the clinic wants you to check this, because your baseline is very important. Now, if especially the patient is undergoing a procedure and the patient comes back, my vision is now 2050. And without the baseline, you're in trouble, because when they came in, it was 2015. What happened? But also, some clinics, they have a pre-stamped form that they have all of this already. They stamp it and you just enter the values. There are things like that on the progress note. If it is electronic medical record, they will also set it up. There's a template that just enter the values that in your reading. You don't have to make up what I missed. You guys following me?
When you do both eyes, you do it with the glasses off and on too? Or-
I'm showing you both off and on, but again, it all depends on the clinic's practice.
Okay.
Yeah.
If the person is mad for putting on the lenses,
If the patient gets mad,
like the contact lenses,
they don't want to remove it.
or take them off and then put them on and...
Okay, well, then they're cheating. If the patient is cheating, you have to capture that. Because the purpose of the eye check is to make sure that you pass the eye check. Because the doctor will be responsible if something happens and you said 20/20, but they're cheating. That's why I'm asking. No squinting, no cheating, no peeping. Because that's the requirement, yeah.
You've got a question back here. If they have contacts, they don't have a case for it, and they need
Very
to take
good
them out,
point.
what do they do?
Some clinics, more often than not, clinics will always have a contact lens container, yeah, for you to remove it. They always prepare that for the clinic. I work in ophthalmology, and I know we have that all the time.
But like at the basic, your PCP, are they gonna have that?
Hopefully they do. They do. If not, then the doctor will have to decide, should I continue with the test or not. But normally they will advise you to bring your contact lens,
Because they know.
the otoscope.
That's the adult side.
Where's the adult side? That's it. Okay. Now, to open this, is just turn it, a switch. Towards you and away from you. Just open. I'm going to check the right eye is a problem. I'm going to have you remove your glasses for me. Eric. And just normally the doctor will examine, and then you will also examine the eye. Up. Okay. It looks like we have a lot of impacted gold, so we have to remove it. And more often than not,
Do you want me to send you these? Make sure
Not on
that,
Facebook, because it's easier for me to see it. Can you send that email?
then the doctor
I'll do it through the
puts on
Dropbox again.
eardrum.
Well, you can do it text
Which is
as well.
It won't, man.
Oh, it won't.
Earwax removal.
It's like 12 minutes each.
Okay.
Oh.
To apply.
I'll send it through the
or use
Dropbox
medication
so you can
that
download it to your
here.
computer.
Are you guys following me? Always check for, first of all, the doctor's order is earwax aid. Look for the expiration date. You have to check for the expiration date. Compare the medication. You want to make sure that's the correct medication, correct patient, and correct dose. The patient says, or the doctor said, instill at least 2 drops. Now, what you need if you're instilling medication, you need a medication.
They're all
you
on
need
like
some
1 or
cotton
2.
balls. Also, a moistened cotton ball is moist to make sure that when you are using this after installation of the medication, that it will not. If it is dry, it will suck off the meds. You guys with me? So you want to have it moist a little bit. Now, Eric, I'm going to have you tilt the head away. The injured or the affected ear, you have to tilt it away from you. Are you guys with me? Now, you read instructions. Any medication, they always have inserts. Are you allergic to any medication? Are you allergic to earwax medication? Have you used this before?
I like Deborah.
Yes. Okay. Are you okay with this?
I'm okay with that.
Can you hear me now? Say no. All right. So, one thing that you need to remember is that some of these medications are multiple use. It's always used in a clinic like for multiple patients. So you want to make sure that the dropper doesn't touch the patient's what? Ear. All right, Eric. I'm going to drop a couple. This is the best way to practice in the clinic. Up and then just making sure 2 drops based on the doctor's order. Have the patient stay there for a few minutes. And if there's any excess medication or fluid coming out of the ear, you can just give them the what? Normal gauze, or just put this moist cotton ball to make sure that it doesn't drain back. Because if the patient what? Leans back, it will what? Just obviously drain the medications out of the ear. So after a few minutes, doctors normally the first order, he will instruct the medical assistant to perform the, want to make sure you don't lay this in a corner anywhere. This is non-sterile because then it will contaminate the medication. Always be mindful, this is new medication. I'm going to initial with my name, the date, and the time that I opened this. Are you guys with me? Can you initial the bar? Yeah. All right. Now I'm ready to irrigate the ear based on the doctor's order. Again, you cannot do air wash or ear lavage without the doctor's order. Then you'll check. Okay, now doc, it looks like it's moist now. It looks like soft now. Yeah. Oh, it smells good. What is that? Here are your supplies to perform the eye irrigation, the ear irrigation. That's too high for me, and that's I'm having a hard time. If you're the MA, I'm gonna have him sit on the chair, please. Want to make sure that the patient is comfortable, and you are comfortable as well. Because if you are not comfortable, you could possibly injure the patient. Are you guys with me? Alrighty. So what you need is the towel or anything that you use in the clinic to protect the patient from getting wet. I'm going to hold you here, and this is the. You can do either sitting up or laying down. So I'm showing the sitting up so that everybody can see. Now, if it is laying down, it's the same procedure.
Can you see this?
Okay, Eric, I'm going to have you. There you go. Hold this for me. That will catch the excess fluid. And there are different ways in what different devices they use in the clinic. This is commonly like the auto clear spray ones that they use in the clinic. You have to see the little tube, and that will be inserted into the ear canal. You guys with me?
Yes.
Yeah. And not all of them. So, want to make sure that the water or whatever it is that the fluid that you're using is for the doctor's order, and it's at the room temperature or body temperature. You don't want to wash the patient's ear with a cold temperature. So now, if you want to come up closer, stand up and come closer to me. My job is going to show you how to do it. Pull the patient back, the ear back and up, and insert the tip of the device onto the patient's ear and point it at the roof of the ear canal. The roof. Are you guys with me? So you start to slowly press this. You can see that? Not too strong that you would bust the eardrum, but good enough so that the water can just flow into the ear canal, and it is what? It is the pressure, the gravity that pulls out the cerumen. So you have to put it at the roof of the ear canal, not directly into the eardrum, but at the roof. Are you guys with me? So when you're doing your externship, you want to make sure that you perform it with the instruction of your preceptor first. Watch how they do it. We're not going to do it live here because we're not allowed to do it. But in the real world, when you start, this is the position. Straight up, point to the roof of the ear canal, then start pressing. Are you guys with me?
Yeah.
Not too strong that you could bust the eardrum. Now you watch for any drained water. Then you will normally you will see the foreign body or the earwax,
Yeah.
and you will see it. Once you see it, you say, okay, now we have a lot that was dislodged.
Wow.
Okay, let me see. And then normally what happens after that first,
So this pretty much wash off that.
yeah, that one softened the earwax. This one will wash it out.
And he has to rest like for 5 minutes?
Yeah.
And this is when they have excessive wax or wax.
Yeah, so anything for the doctor's order, yeah. Or if the ear needs or requires some irrigation. So again, the doctor will have to look at it again if it is clear. Before you discharge the patient, you want to make sure that the doctor looks at it. All right? You can also use the syringe that Fernando is showing there. All right? Where's my syringe?
Leonard, can you kind of divide it, like one side go first and then we come up so that
Yeah.
we can also...
Okay, one side first will wash, and then when you're done, you can come and... Okay. So
Which
for the
side?
irrigation, you want to make sure that this is used for, like, for example, there's a foreign body or some chemicals. You will have the patient lean towards the affected eye. Are you guys following me? Earlier, away for the ear, for the eye towards. And why is that?
So you don't get the contaminants from the other eye.
Absolutely. So you will not have cross-contaminate to the other eye. Also, at the same time, you're going to be washing or irrigating from the inner canthus out to the eye. Are you guys with me? And that is why you are going to be having the patient hold this. There you go. And look up. Stare at your beautiful X. So then you will have what? Okay. Maybe a little bit there. Let me show them. This is the lower eyelid or the conjunctiva. Have the patient look up, and what you'll be doing is again away or towards the affected eye, and you will give the patient a cotton ball or 2x2 or 4x4 gauze to wash for any excess water. You will instruct the patient. I want you to just look up, stare at the. Normally in the clinic they have this beautiful picture of like the beach or anything, so they'll focus in there. And this is a big. I need a small syringe, but right. Okay. Help. Thank you. Tip. You put a tip. This is like a real thing. Give it a tip. Tip. The impatient is like my fish waiting. Alright, so with the cotton ball or 2x2 gauze, open up the conjunctiva, the lower eyelid, have the patient, and then just, I don't want to start slowly irrigate the eye from an inner to outer part of the eye. Inner canthus to the outer part of the eye. You guys with me? Yeah. Want to make sure you don't hit the eyeball.
You're doing good, sir.
You're doing good. You're crying. One more time.
It's gonna be okay.
So from in, out. Are you guys with me? And you have the control. If you do it really strongly, then you will injure the patient's eye. So you pretty much adjust based on how comfortable you are holding this syringe. All right. Now, any other questions? You watch for any foreign bodies being dislodged after the irrigation. So you look for the water. So this is normally they have the kidney basin that they use, so that it will be clear when you look at the liquid. Always remember, it has to be room temperature, not too hot, not too cold.
And I always ask the patient, I test it on their skin, okay, how does that feel? Oh no, it's too cold, or too hot, okay, and then I either add or remove hot cold water.
Something like the doctor said, oh, the patient Eric was washing or cleaning the exam room, and then all of a sudden some chemicals passed into the eye, or any foreign body that you want to dislodge. They can do that too, but this is like the proper way of irrigating the eye.
So we get to practice with Eric, all of us?
Yes. Yeah. All right. Now we have to irrigate. Make sure that you understand the proper medication. Check for the medication. The right medication is not what? It is not expired, and the right medication for the right patient per doctor's order. I need a cotton ball. So again, based on the doctor's order, how many drops? Same thing. You will label once you open it. And pretty much the same thing with the medication, but now you have to look up. You're not going to have them lean towards the injured eye. Just stay center. Okay. Open the conjunctiva, little eyelid. Focus and make sure that based on the doctor's order, just put 1, 2 drops, and then have the patient close the eye. Have the patient prevent from blinking as much as you can. Yeah. And then you can put a little pressure on the inner canthus, so that the medication will not drain back into the throat, yes? And have the patient rest for at least 5 minutes, and the doctor sort of said, okay, it's good. Now, if it is an ointment, remember that the dropper will not what? Touch the patient's eye. If it touches the eye, and this is a multiple use for all the patients, then it has to be thrown away because it's contaminated. If you're sending this patient, the rest of the medication with the patient home, then you can instruct them, making sure that even if it is on medication, you want not to touch your eye, because your eye could be contaminated, right? Okay. Any questions? Yeah, wiggle, look, okay, yeah. There you go. Perfect. But stop blinking, sir. Okay. Alrighty. Are you guys familiar with this?
The gate?
This is the gate belt. Alright. I'm going to demonstrate to you guys on how to transfer a patient from the wheelchair to the exam table and back. I want to make sure that depending on the patient's height, if the patient is what? Is too short, obviously need a stool to transfer from the wheelchair to the chair or the exam table and back. Now always remember, based on the clinic's policy, the proper way of transferring a patient requires a gate belt. What is the gate belt for? Okay. Did you lock yourself?
Locked up. Okay. Lock your wheelchair.
Now always, first thing is always check when you wheel the patient from the waiting room to the exam room, that once you once you arrive in the examination room, always lock the wheelchair, and you can press this button to remove or to move the footrest to the side, or you can move it or remove it or take it off. Are you guys with me?
Yeah. Transport of the wheelchair.
Yeah. Now, your weak side is the left. So the strongest side will always be closer to the table. All right, I'm going to have, hi Eric, how are you doing today?
So good.
You're going to see Dr. Bernard. I'm going to transfer the examination room. I'm going to bring you closer to the...
Okay.
There we go. All right, have you used I'm going to have you raise your hand for me. Yes. After this, you're going to be in a coffin. We're going to make sure the... Did I say that right? Apply the gate belt, not too tight and not too loose. If it's too tight, it could break and fracture the what? The ribs. So if you have loose ends of this, the loose end of this gate belt, you can tuck it in. Yes. Alrighty. Love it. Okay. So put in your hands down. Eric, thank you very much. I'm going to transfer you. You're going to help me move yourself from the wheelchair to the exam table. Are you okay? You ready? All right. So I want you to move closer to the edge of your wheelchair. Very good. And you can pretty much push yourself. You're pretty much strong, right? So wait for me, sir. Wait. Now, this is a patient that is having a hard time, what? Walking or standing or even transferring from the wheelchair to the exam table. So I'm going to have the patient hold, not on my neck. Where would he be holding me? On the shoulder. And I will be holding him with my hands holding up below on the gate belt. I guess with me. Tap my insert my hand at the upward position using the gate belt. Yes. have them stand up at a count of 3. Both of you will what? Will stand up. Also, if the patient can push himself up, you can actually have him push himself up using the armchair. Yes?
Yes.
All right.
Give it all you got, Eric. You can do it.
I was always told by the therapist that they can put their feet behind them a tiny bit, it makes it easier for them, so when they push up, because if their feet are up, they will do this.
Yes.
So depending on the range, so you
Right,
put
yeah.
it back.
Also, what is your stance? What is your position? Is it in between the legs, knee to knee,
One between the legs.
or you stand that you will be stable enough? Okay, so you have